Missed your period but got a negative pregnancy test? This can be a stressful and confusing situation. Let's explore the possible reasons behind this occurrence and what you can do about it. First, let's talk about irregular cycles, the most common cause of a missed period outside of pregnancy. Regular menstrual cycles typically last between 24 and 36 days. Irregular cycles don't follow this consistent pattern and may be shorter or longer than expected. This can make it seem like you've missed a period when in reality, your cycle is just longer than usual. Several factors can contribute to irregular cycles. Medical conditions like polycystic ovary syndrome, or PCOS, can make ovulation more difficult, delaying the start of your next period. Lifestyle factors such as overexercising, undereating, or experiencing high levels of stress can also influence your cycle length. In many cases, a missed period is caused by late ovulation. Ovulation occurs when a mature egg is released from the ovary, typically 11 to 15 days before the next period begins. When ovulation happens later than usual, it can extend the length of your entire cycle. It's important to note that some variation in ovulation timing is normal. However, if late ovulation becomes a pattern or your cycles consistently last longer than 35 days, it may be time to consult with a healthcare provider. To better understand your cycle, consider tracking your ovulation. There are several methods available, including observing changes in cervical mucus, monitoring basal body temperature, and using at-home hormone tests. These methods can help you identify when ovulation occurs, allowing you to more accurately predict when your next period should start. Now, let's address the possibility of a false negative pregnancy test. This can happen when there is actually a pregnancy, but the hormone levels are too low to register on the test. To minimize the chance of a false negative, use your first morning urine sample, as it's typically the most concentrated. Also, avoid taking the test too soon after ovulation, as it takes time for pregnancy hormones to build up to detectable levels. The best time to take a pregnancy test is after a missed period. This allows sufficient time for hormone levels to rise if you are pregnant. If you've waited until after a missed period and still get a negative result, it's likely that you've experienced a late ovulation rather than a pregnancy. Remember, every person's menstrual cycle is unique. If you're concerned about irregular periods or have questions about your reproductive health, don't hesitate to reach out to a healthcare professional.